Emmy-nominated American Morning, CNN, weekdays 6 Eastern.
If you look at the numbers across the country, they're still very much heading in the wrong direction. One of the things that people pay attention to, I think more than anything else, especially at the national level, has to do with the cost. And I think when you look at some of these numbers, Karen and John, these numbers are quite staggering in terms of what this costs overall. Like if you look at the cost of obesity overall, as things stand now, about $147 billion a year. You break that down specifically into childhood obesity, just per year, $14 billion associated with chronic disease associated with childhood obesity. What's projected to happen over the next 8 years, just in 8 years, not even a decade, $344 billion will be the cost of taking care of diseases associated with obesity, and specifically, if you want to break that down overall into healthcare expenditures as a country, almost a quarter, 21% of total medical costs used to treat these sort of diseases. $144 billion a year now. Just to give you some scale of reference, to take care of all cancers out there, the diagnosis and the treatment of cancers is about $104 billion. So this has surpassed that as things stand right now. People are paying attention. You're starting to see more incentives for people to stay healthier, both at the national and the state level. And you are seeing about 3/4 of people who say they get the message. About a quarter of people simply don't seem to respond at all. They're not changing their diet. They're not changing their activity levels at all based on all the messaging that's out there. Now, there are significant racial, ethnic, geographical differences that simply make it harder for people living in some areas of some backgrounds to try and get access to healthy foods and to places where they can be active. But still, I mean, think about that. A quarter of all healthcare costs due to this somewhat preventable problem.
Yeah, and you know, it is a complex issue because I mean, we've dealt with poverty, we've dealt with all of that before, but we're still seeing this spike, it seems. And I know they're spending a lot of money on it. What did they point to? Any type of initiative that actually seems to be working and making a dent in this?
Right. With regard to many of the things that we talked about, Karen, over the last year in healthcare reform, looking at some of the incentive programs, admittedly, that's going to take some time to actually see the effects of that. But one place that actually did decrease its obesity rates this year as compared to last year was Washington, D.C. And what was surprising to me when we talked to these folks was that some of the simplest measures seemed to have an impact. For example, take a look at some of these things. Doing things like simply adding more bike lanes, creating wider walking paths, adding more parks. They had this big renovation project where they added more parks. They opened rec centers, free nutrition classes. It's amazing how high the health illiteracy rate is when it comes to nutrition specifically. And also in schools specifically, starting mandatory health classes. I don't know if you had health classes when you were in school, but mandatory health classes, mandatory physical ed classes, we know a lot of schools have cut those programs back. School lunch overhaul. I mean, so many school lunch programs simply did not help with the childhood obesity problems, and nutritional standards across the board have become stricter. So that, at least in D.C., seems to have made a difference if you sort of take that in aggregate. It's hard to assign any one of those things as the biggest sort of benefit, but you look at those things. They're not complicated things, and they've made a difference in a state, in a place, I should say, Washington, D.C., that had a significant problem.
I remember when I was in school, we had health class, but we never talked about nutrition. We ate fairly healthy. The school lunches were pretty healthy, and we just got outside a lot, and we didn't sit around on the couch playing video games.
Right.
And there were hardly any overweight kids in our school. I mean, look at you. You're a shining example. You just got to get out there and exercise, right?
You do have to exercise.